From a public health perspective, there is no question that reducing overcrowding, improving hygiene, and getting people out of detention who do not need to be there for public safety and security is an urgent public health priority. I'm going to just make a couple of key points about why we're so concerned about COVID-19 and people in prisons, jails, and in detention. So the first thing to say is, of course, that we now know this highly infectious virus. The spread of it is facilitated by density, population density, and by crowding. That is why all of us are being asked not to go into crowds of larger than 10, to stay at home, and to avoid the kinds of crowded contexts that facilitate the spread of this respiratory virus. That is enormously difficult to do for people in detention facilities. Many of them are overcrowded. They are always crowded places where it is very difficult to achieve the physical distancing of 2 meters. 6 feet distancing that the CDC is recommending. It is also, of course, enormously challenging to maintain the kinds of hygiene that the CDC is also recommending in these kinds of facilities. Many prisons and jails have a copay for soap, and soap is a limited commodity. And of course, many ban the use of hand sanitizer because it contains alcohol and can be a substance of abuse. So all the things that we are asking all Americans to do, we are enormously challenged in doing for the people whose liberty has been taken away on our behalf. That's the first thing to say. The second is, of course, that we already know that there have been COVID-19 outbreaks in other prisons and jails. These have been prominent features of the early epidemics. There was prison outbreaks in Wuhan, and of course, there is a major prison outbreak underway right now on Rikers Island in New York City. And so, that's the empirical evidence that you need to say, yes, this is a very real public health problem. These would not be the first prison-associated infectious disease outbreaks. My own group at Hopkins has worked extensively on tuberculosis and multi-drug-resistant tuberculosis epidemiology in prisons and jails, with MRSA, methicillin-resistant staph, with hepatitis C, and of course with HIV. Many of these infections, and particularly the respiratory ones, are known to concentrate in prisoner populations and detainees. And again, it is the physical environment that so often predisposes to spread in these kind of contexts. The third thing to say is that, of course, people often perceive that prisons and jails can be hived off from the rest of society, and that in some way that they are a kind of quarantine already. Now, one of the ways that people have tried to respond to this, and this was prominent in China and also in the Italian prison system in response to COVID, is to stop visits from family members to prisoners, to try and reduce the exchange with the community. But this actually cannot be done. Almost all of these facilities have 3 8-hour shifts a day. They have staff constantly in and out. They have guards constantly in and out. And in the COVID-19 outbreaks we've seen so far in these kinds of facilities, it has been the detention facility staff, guards, but also other staff, who have been most affected, particularly at the beginning, and who are the most likely people to bring this virus into these detained populations. That happened in Wuhan, it happened at Rikers, and the early evidence is that that is happening in Maryland. There are more cases in contract hires and facility staff in Maryland than there are at this point among people who are detained. So that is a real concern. And again, it's something we cannot address by trying to assume that we can hive these populations off. The last point I would like to make is one that is new and newly emerging. And that is that many of you will have seen the reports from Detroit, from New Orleans, from Chicago, from New York, that there is higher morbidity with this virus and higher mortality with this virus among African Americans. We are just beginning to understand the epidemiology there. Of course, many of the underlying conditions like hypertension, diabetes, heart disease, that are associated with poor outcomes and death from COVID-19 disease are also higher prevalence and higher burden in American communities. And I don't have to tell all of you, I'm sure you are aware, that African Americans are disproportionately represented in incarceration in jails and in prisons. Just to give you a feel for that, less than 12% of New York City's population is African American. Half the people in Rikers Island are Black. So this is also a racial and ethnic discrimination issue, and one that we have to take very seriously in our state, where we already know, unfortunately, that Maryland has a significantly lower life expectancy for African Americans than other populations. In Baltimore, that is very marked, and that is something that should be of concern to us all.